Okay, sorry I'm a little crooked, but I just set my phone up so I didn't have to hold it while I was making this video. So I just wanted to talk a little bit about like my doctor's plans going forward, like what her plan of care is for me right now, and what's going on. Just a little bit of a health update since I was in the hospital with the right-sided weakness and just struggling with all that stuff. So she basically, when I went into her office, she did a neurological examination. She had me walk in her office to kind of see the progress that I've made since I've been out of the hospital. Because before I even left the hospital, the last time she saw me walk, I couldn't pick my foot up off the floor at all. So she said that she was really happy with the progress that I made. She wants me to continue to make progress. She wants me to do physical therapy on my own because as of right now, she doesn't think that it's really necessary for me to have physical therapy via home health services anymore. So I'm basically done with physical therapy at home. She's not sure if she's going to have me do physical therapy like outpatient as of yet. She wants to see how I do like the next couple of times that she sees me. I have to go back into her office in 2 weeks to get some testing done to find out if I have nerve damage, because when she was doing her neurological assessment, like she had this little instrument that was vibrating, and she put it on my hand and I could feel it. She put it on my forehead, I couldn't feel it. She put it on like the upper part of my leg and I could feel it. And then as she moved below my knee, I couldn't feel it at all. So I'm dealing with some shit. Basically, she says that I have neuropathy, but she doesn't know what's causing it. She doesn't feel like it's related to my MS. So she wants to find out what's causing my neuropathy, which is why she started me on the gabapentin. I took gabapentin when I was first diagnosed with a seizure disorder because it's actually a seizure medication, but it's supposed to help with like weakness, neuropathy, nerve pain, and things like that. So we'll see how it actually does. I'll probably do like a little video talking about my experience. I have to pick up the medicine today, so I haven't started taking it yet. She just prescribed it yesterday. But yeah, she's gonna basically do this testing to find out if I have nerve damage, because she's trying to figure out what exactly is going on. Because like I said, she doesn't think that it has anything to do with my MS. So she said it's a little bit concerning that I have this neuropathy and she doesn't know why. So she's going to do this testing, and then basically based on the results of this testing, we're going to go from there and see what her next steps are. I thought it was really funny yesterday when I went into her office. I've never been to this doctor before. So it was interesting. The first time that I saw her was when I was in the hospital recently in March. So it was interesting to see how her office was. First of all, she was on the 3rd floor in like a remote corner of this medical center. And then I guess she is in a pain clinic. So I had to sign all these papers saying that I would be willing to do random drug tests because they give out opiates, and the state of Indiana has a requirement that if you are on an opiate prescription from a pain clinic, I guess, that you have to be willing to submit to random drug tests. So then they know that you're taking the medication like it's prescribed, and not overdoing it or selling your pills. So they're basically just checking for the presence of the drug in your system and the levels. But I'm not on any opiates or anything like that. Like I said, the only thing she prescribed to me so far is gabapentin. And like I said, I go back May 17th to do this testing for the nerve damage. Basically, I guess what the testing is, it's called electromyography. It is basically where they're gonna do electric stimulation or something of my muscles, and then electronic stimulation, muscle stimulation, something like that. I can't remember what exactly she explained it as. And then after that's done, she's going to come in and stick a bunch of needles in me to see how I react to that. So I'm not looking forward to the needle portion of this whatsoever. I used to be deathly afraid of needles. I'm not afraid of needles anymore, but it's still just the thought of getting numerous needles stuck into my body does not, it doesn't really make me happy, that's for sure. I will probably make another video to kind of show you guys a little bit more of my progress as far as physical therapy and physically. I don't really know that it's much different from how it's been since the last time I showed you, but I'll make a video still to show you guys if that's what you'd like to see. And yeah, that's pretty much it. I'm just sitting here waiting for Paul to get done with his haircut. So, all right, that's pretty much it for my update. I do have like numbness and tingling in my legs, and yeah, that's pretty much where we're at right now. But anyways, Paul's done, so I'll talk to you guys again soon.